Ladies and gentlemen, again, I thank you for being here. I am happy to report that South Carolina is making great progress. We are coming together, working together in a way that we see in these emergency situations, and it's comforting to see it happening again with this unprecedented situation and unprecedented emergency. I have a progress report and an update in a number of areas. You remember we asked the state employees to work at home according to their supervisor's discretion. We now have working from home in state employees 15,238. Working as normal in the office, we have 15,812. It's almost 50-50. We are hoping that we can move that 50-50 number up to 75% working at home in the next 2 weeks or so. We urge our private employees also to follow this example to the extent that they can, because we know that this makes a difference. It's the closeness and the inevitabilities of contact on surfaces and hands and things, as well as coughing and sneezing, that make this virus so dangerous. All plans and contingencies are on the table. We're not ruling anything in except those we've already ruled in. We're not ruling anything out. And that includes, has been asked by many, shelter in place, which is a stay home shelter in place order, which we have not issued. And that is a drastic action, and we all hope that that will not be necessary. And many South Carolinians are taking precautions that will render that unnecessary. They're staying home, they're using good personal hygiene, they're washing their hands, they're cleaning surfaces, they're not touching their nose, their mouth, and their eyes to contact and spread the disease, and they are using common sense. I know it's hard to not touch things and then touch your face, touch your eyes, nose, and mouth, which of course leads to the respiratory part of this. It's hard to do that. That's why you must keep washing your hands all day long. And that's why it's important to stay away, keep that social distance from others so that you're not spreading things by contact and also by sneezing and coughing. So for all those who are out there working so hard to see that our people are safe, I want, on behalf of all the rest of us, I want to say thank you very much. We appreciate it and urge you to continue to do it, but to do it with more vigor and attempt to set as good an example and as an obvious example as you can for all of our federal citizens, our common citizens, our friends and our neighbors. Many people are not using common sense. Now you see, I'm rubbing not my eye, but right under my eye. That is, and I've just washed my hands, so there's nothing on my hands because I washed them for almost a minute ago. That's about the only way you ought to be touching your face. But there are a lot of people that are not doing that, and those are the simple things. There are a lot of people that are congregating. There are a lot of people. You go into the beaches in big crowds, a lot of people going into the parking lots, a lot of people going at the shopping centers and things like that and congregating, and that opens up all kinds of opportunities for the spread of this virus. And that lack of discipline, that lack of consideration, lack of forethought, and lack of consciousness about what is going on is what will result in the spread of this virus. So I want to ask everyone to redouble their efforts to see that we do not jam people together. We don't have groups, whether it's spontaneous or planned, and not to put others in that immediate contact that results in this infection. That is how it is spread, by touching each other, touching one's stuff, and then going to your hands with your nose, mouth, and your eyes. So I'm issuing another executive order under this state of emergency. And it is this, to reinforce this point and to allow us to take official action. There is a state statute, and it reads and allows this, and I want to make everyone aware now. I'm hereby authorizing, ordering, and directing any and all law enforcement officers of the state, or any political subdivision thereof, in accordance with the South Carolina Code of Laws and other applicable law, to prohibit or disperse any congregation or gathering of people unless authorized in their homes in groups of 3 or more, if the law enforcement officials determine in their discretion that such gathering or congregation in people poses or could pose a threat to public health. Now, this is statutory authority our law enforcement officers have. It is similar, you could say, to a public nuisance statute, which is a civil statute, but this is a criminal statute and it's a misdemeanor. And this would apply to a lot of things. It would apply to parties on the beach, to boisterous gatherings or concerts, to spontaneous gatherings or unruly gatherings in shopping centers, parking lots. Those are the kinds of things, and we have all seen them. What it does not apply to, what it is not intended to apply to, is law-abiding businesses or employers. It's difficult to draw the line, but we know it when we see it. And law officers have this authority by state law, and under this state of emergency, I'm asking them to implement it vigorously according to their discretion. We must not have these sorts of gatherings that are invitations for infection. I want to thank some people who have done a lot of great work. We've asked for the contractors and construction companies to go through their materials and see if there are personal protective equipment that could be given, donated to the hospitals and others, and they have come forward in a remarkable fashion. And these include Sloan Construction Company, Lineberger Construction, PCL Constructors, Hood Construction, D.R. Horton, Professional Building Supply, Builders First Source, and I know there are others that are coming in as well, and we appreciate that very much. That is the South Carolina spirit that is so alive and well in this emergency, as well as when we have others like hurricanes and floods. It's neighbors helping neighbors. Here's some facts. According to the South Carolina Medical Association, the South Carolina Hospital Association, you recall we asked to move those people out, put off elective surgery if it's not urgent, to go ahead and put that off, to leave the beds available for those who may be coming in as a result of the virus. Well, today there are 56% more vacant hospital beds today than were when I asked the hospital to suspend those elective procedures last Tuesday afternoon. What that means is that there are 1,819 more beds available to handle that than there were 6 days ago. And we're also working with the National Guard, with Fort Jackson, General Beagle, with others to find places that we can use as an overflow for the hospitals in order to bring the virus patients that need isolation into the hospitals. Last week, I asked the grocery stores, pharmacies, and retailers to set aside special senior hours so our senior citizens could go in without the rush of other customers and buy their necessary items and groceries and things that they need. Again, the spirit of South Carolina is evident, and so far, and the list is growing. We've had responses of setting aside senior times for shopping from the following: Aldi, Buy Low, Costco, Harris Teeter, Ingles, Kroger, Lowe's Food, Publix, Target, Walgreens, Walmart, W. Lee Flowers, and Food Lion. That is a remarkable response in South Carolina to that request. Also, another note, 91 Small Business Administration loan applications have been made by South Carolinians since the state was approved 3 days ago, and our entire state has been approved for these Small Business Administration loans. And I want to say again, finally, to all the citizens of South Carolina, if you don't need to be in a public place, if you don't need to be out, then don't go out. This is a good time to stay home. There are a lot of things we all need to do at home, whether it's cleaning out the garage, reading a book, fixing something. There must be 1,001 things that we all always looking for some time to do. Well, time has arrived. This is a good time to stay home if you can. Don't be in a public place, because we must all assume that we have the virus, and we must all assume that the people we're talking to have the virus. If we all take those kind of precautions, then chances are that virus is not going to spread, at least on that event there. We urge everyone, remember, wash your hands. Keep your hands away from your eyes, your nose, your mouth, because you may be bringing something that you contacted on a table or a desk or a steering wheel or a doorknob that somebody touched the day before, and you scratch your eye, and there you go. You're subject to that infection, because it's a strong virus and it lasts a long time, particularly on steel and plastic and things like that. Prevent this spread. Don't hoard supplies. There are plenty of food, plenty of things coming to the grocery stores. They're going to be open. There's no need to hoard supplies. And always follow the information of the official sources only. There are a lot of rumors. You wouldn't believe some of the rumors that we hear. I don't know where these rumors come from, but some of them are just as wild as they can be. But follow the official sources. Get your information from the official sources and not from any place else. And that's one reason we're having this press conference. It's one reason we send out as much information as we can in order to answer the questions of the people. And I know DHEC and other institutions are doing the same thing. So I want to thank the citizens for working so hard, and want to urge those that are not yet, don't seem to have a grip on how serious this is, urge them to think it over and be courteous, be safe, and let's don't be sorry. Let's be safe. Dr. Bell of DHEC, if you please.
Thank you, Governor, and good afternoon. As of today, South Carolina has confirmed cases of COVID-19 in 34 counties across the state. The counts per county are posted on our website and are updated daily. To date, we have reported receiving 295 confirmed cases from our public health laboratory and private laboratories, and our public health laboratory has performed 2,239 tests, of which 2,012 have been positive, or approximately 10%. Sadly, this now includes 5 reported deaths of patients who had previously been reported to us as being diagnosed with COVID-19. 2 of these cases were reported earlier today. Each of these patients were elderly and had underlying conditions prior to testing positive for COVID-19. On behalf of all South Carolinians, we want to express our deepest sympathy to the family and loved ones of these patients. This loss of these fellow South Carolinians is a reminder of the importance of taking precautions to protect those at highest risk, like the elderly and people with serious underlying conditions. I would now like to provide a situational update of the status of COVID-19 in the United States and here in South Carolina. And according to the CDC, the United States is now in the initiation phase of a pandemic. This is based on a pandemic interval framework, which describes the progression of pandemics in 6 intervals or phases. The duration of each phase might vary depending on the type of the virus and the public health response. Different parts of the country are currently seeing different levels of COVID-19 transmission. Nationally, the U.S. is currently on the initiation phase, but states where community spread is occurring are in the acceleration phase. This would include South Carolina. The acceleration phase means the need for the transition from contact investigations of each individual to prioritized investigations around those who are at highest risk of being exposed, and a broader community-focused measures as what we are doing now. Realizing that spread is occurring, we encourage the public to focus on things that each of us can do to limit the spread of illness. This includes washing your hands and covering your mouth when you cough, avoiding groups, and especially staying home if you are ill. As the lead public health agency in South Carolina, one of DHEC's primary missions is to protect and promote the health of the public. One critical activity that helps us carry out that mission is conducting surveillance of selected infectious diseases. And the principles of disease surveillance are to collect information about where diseases are occurring, to analyze the data so that we can understand who is being affected, and then to interpret and share information that prevents the spread of disease. We understand the increasing interest in every detail of cases in each community, but I believe that the desire for this information on an individual basis has led to complacency in areas where we don't have information about disease being spread. It gives a false sense of security to rely on information from individuals within your community, when what is recommended is that follow the guidance that has been provided, regardless of whether or not you know cases are in your community or in your specific neighborhood. It is suggested that many did not take seriously the measures that had previously been recommended because cases had not been identified in their communities, and this is why spread continues to occur. If we change those behaviors, we can slow the spread and stop transmission. As I've stated previously, this will be an extended response, and we want people to be prepared for more cases to occur and to continue to listen to and follow the recommendations from public health officials. We recognize the hardship that many South Carolinians are facing, and it is important for all of us to protect our health, but also our mental health and our emotional health during this time. Remember that everyone copes with stress differently, and to ensure that you protect your mental and emotional health, it's important to take breaks while many are in isolation and we are practicing social distancing. But particularly take breaks from watching, reading, and continuously listening to news reports about COVID-19 and social media. Hearing about COVID-19 continuously is a stress-inducing event. So we encourage to take breaks from that kind of information. Take care of your body, eat healthy, balanced meals, exercise regularly, get plenty of sleep, and avoid alcohol and drugs. Make time to unwind and participate in activities that you enjoy, and connect with others. Talk with people you trust about your concerns and how they are feeling on the phone and through responsible social media. We tend to spend a lot of time interacting with others, and that understandably raises concerns about what level of caution we should take to do necessary activities. Everyone should continue to monitor for symptoms and still practice social distancing. Avoid touching frequently touched surfaces and items like doorknobs and rails, and remember to regularly wash your hands, as always, after being in public places. But also remember that the disease is most commonly spread by respiratory droplets that are coughed or sneezed by direct contact with people who have signs of illness. People with signs of illness must stay at home and avoid public gatherings. Those who are charged with caring for a family member, friend, or neighbor who is at greater risk for becoming ill are asked to follow information provided by the CDC and by DHEC to safely provide this care at home. This continues to be an emerging and rapidly evolving situation, and DHEC will provide updated information as it becomes available, and will continue to provide updates on our webpage at scdhec.gov/COVID-19. Thank you, and I'm happy to address any questions.
Thank you. Any questions?